This is National Infertility Awareness Week, and infertility is a major problem for many couples. So let's go visit with an infertility expert and find out about the causes and treatments, and some of the newer treatments may actually surprise you. I'm joined now by Dr. Lisa Hasty. Lisa is a reproductive endocrinologist and an infertility specialist. Big words, and thank you very much for joining us. So how do you define infertility?
Infertility is really the lack of pregnancy within a year's duration if a woman is under 35 and has regular periods. If she's older than 35, we really start the workup and consider them infertile after about 6 months.
I was struck by how big of a problem infertility is. It says 1 out of 8 couples and 12% of women have problems. Is that correct?
That's correct. And then age-specific numbers are even more impressive, that at age 40, 1 in 4 couples, if the woman is 40 years of age, 1 in 4 are infertile.
So Lisa, this is a giant problem, and I'm used to thinking this is a woman's issue, but it also could be, the male could be the cause, isn't that right?
That's correct. About a third of the time it could be a male problem. About a third of the time it's strictly female. And then the other third of the time it's a combination of both male and female factors. That's why we really like to see both folks come to the initial consult, because it could be a little bit of both, it could be specifically one problem, and it really is a couple issue.
I'm sure there are many causes for infertility. Is age a cause?
Age is probably the leading reason that we see infertility on the rise. People are waiting later, getting married later in life, that it really becomes a dominant factor.
Lisa, how does being overweight affect infertility?
In vitro fertilization rates are significantly impacted by weight, not only by the fact that it's harder to retrieve the eggs, they don't respond as well to the medications if they're overweight, miscarriage rates are higher. It definitely plays a role.
Once you've identified the causes, what are the treatment options?
There's a variety of treatment options. If it's an ovulation problem, we generally are looking at a medicine or combination of medicines to make those cycles regular. Other times we're looking at a surgical problem. It could be removing a fibroid or a polyp from the uterus. But nowadays, the most common thing that people think about is the option of in vitro fertilization.
Right. When I think of infertility treatments, I'm thinking of IVF, but I was amazed to find out that it actually is a small percentage of the way you treat patients. Is that correct?
That's right. We probably can help the majority of patients with simple treatment. It's about a third of our patients that ultimately need to think about the higher tech treatments.
If everything else has failed and in vitro fails, are there other options?
There certainly are, and it so much depends on the couple's problem. But if it is found to be an egg problem, many women will turn, and couples will turn to the option of an egg donor. If it's an unexplained problem, it's interesting that sometimes taking a break, sometimes getting in some extra support and counseling, and maybe even the technique of acupuncture is thought to have some beneficial role in all of this.
What's it like when you have success? I mean, it must be tremendous. The patients bring their babies back to you and all that.
We had a sweet patient return yesterday at age 41 who had tried for about 4 years, who brought her son back, and we didn't want to give the baby back. It was just too precious. But you get very close to couples, and you go through hard times with them, and you hopefully end on a happy chapter. But it's a very rewarding specialty because we are being able to help so many people now, and that means a lot.
For Health Watch MD, I'm Dr. Randy Martin.